welcome to CHOP.
We really wish you could be here right now, but in the meantime,
here's a small taste of what being a pediatric anesthesiology fellow here is all about.
So I decided to come to CHOP because I imagine that there are very few places that offer the wide breadth and variety and sheer number of cases that we do here. We get the opportunity to take care of a lot of really complicated and sick children, which I think is exactly what I was looking for in a peds anesthesia fellowship.
Cases and the experiences are definitely very, very varied and just really rich, and I feel like every day is challenging, but in a good way. And I think the community here is just so supportive. The minute we started, everyone has been very just welcoming and just very understanding. You take a lot of ownership of what you want to do and what you want to learn.
CHOP has a world-class just support network. And what I mean by that is world-class PICU, world-class NICU, people who at any time of day or night you can call and ask for help and get really just amazing people surrounding you within 10 minutes of you encountering a problem. Same thing can be said for our department. If you have a really complex case, which of course I think it goes without saying you will encounter here, you can run your ideas by your other faculty. People who have been here for 20, 30 years, and you can just bounce ideas off each other and really just make a solid plan, and you feel really just prepared for your next day.
Our regional experience here has been really awesome. We get to do lots of traditional peripheral nerve blocks, especially lower extremity single shots and catheters. But we also get to do a lot of other types of blocks like infant spinals and caudally threaded epidurals for a lot of our abdominal and thoracic cases in the younger babies. And they're also really open to a lot of other types of blocks like QL blocks and TFP blocks for certain abdominal procedures, and things like suprazygomatic blocks for some of the cleft palates. So there's a lot of different experiences that we are able to get here.
Starting from day one, I was absolutely encouraged to use ultrasound for difficult IV placement in arterial lines and really any access needed in small babies or neonates. I think my skills thus far have come a long ways away. I'm very independently able to place IVs in arterial lines with ultrasound guidance.
We have almost an ultrasound per operating room. We have an ultrasound in our MRI induction bay. We have an ultrasound in our special delivery unit. We have ultrasounds at all of the ASCs. So it's just anything you'd ever want. Fiber optic scopes, glide scopes. You never even have to think about it. You just, one phone call away to a tech and you can have whatever you need.
Our anesthesia techs and support staff are amazing. So when you walk in on your first day in the ORs, you'll see your IV fluids are already spiked, your blades are already out, the IV supplies, everything's already set up. All you really need to do is pick out your right size tube, check if you have an LMA, which you usually do, and then drop your meds. It's amazing. And then you can go and see your patients in pre-op and talk to the other team. So it's really nice.
While you're here, you participate in a service learning or administrative project. This can be anything from developing curriculum programming for the fellows retreat to being a quality improvement patient safety liaison. That happens in conjunction with mentorship along the way. One of the other strengths of the program is that we have longitudinal mentoring relationships that get set out of the gates even before you start. You've already been in touch with your mentor. We have mentors for each of the academic and service learning projects, as well as a general life mentor who is your touchstone person to provide you with clinical guidance, life support. It's the person that you can go and decompress with at the end of a long day and who's there available to you whenever you need.
We are lucky to have a pretty rigorous academic program here at CHOP in terms of learning for our fellows. One of the main ways that we do this is through some dedicated academic time that the fellows have for lectures every Tuesday morning for about 2 hours, where they hear on a variety of topics, some that are lecture-based, some that are simulation, others that are practiced for the oral boards or for the written boards. We do a lot of intraoperative teaching as well, and so these can be discussions about the cases that you're doing with your attending one-on-one, although we also find times to grill the fellows and do a little oral boards practice as well too when we're in the operating room.
Everybody who comes through the program has an academic project or a scholarly project that you work on, and that's also in conjunction with assigned mentorship. And these are all projects that are assigned to you based on your stated areas of interest. When you graduate from here, you will have completed or had some significant engagement in scholarly work.
And before you go, let's not forget that you'd be living in one of the most exciting, vibrant cities in the country. Philly really has something for everyone. The food scene here is out of this world. If you love spending time outdoors, hiking, biking, we have that too. If you're like me and you love history and museums, we have plenty of that as well. One of the great things about CHOP is that our program understands the importance of living a balanced lifestyle and overall wellness. So you will have time to explore Philly and the Northeast, pursue hobbies, and try out new experiences.
CHOP is a really special and magical place. We do many clinical cases, and just like any other ACGME accredited fellowship program, you will see a ton of volume in terms of patient care. But the thing that I think really makes CHOP special and different from other places is the faculty. The main message that I would tell you if you were here talking to me is that any area that you are interested in pursuing for your career, whether it's clinical medicine or patient safety or medical education or research, we have experts in that area, and we have the raw materials here for you to be successful.